let's begin.
Sure.
You received part of your advanced education at the School of Medicine and Dentistry at the University of Rochester, following Basil Bibby, Joseph Volker, Cyril David Marshall Day, John Hine, and Erling Johansson. You're the 16 at Tufts over 80 years. Can you comment on that?
Sure. When I was a senior dental student at Guy's Hospital in London, University of London, I was fortunate to receive a traveling scholarship, which took me to the dental school in Buffalo, New York. While I was there, I had the opportunity to visit Eastman Dental Center in Rochester. And almost on a whim, if you like, although it was a little bit more serious than that, I found out that they had a vacancy created in their pediatric dentistry residency program. And so I applied to do that. So I graduated Guy's in 1975, summer of 75. And in August of 75, I came to Rochester initially for a 2-year program. I really didn't understand the significance of Rochester at the time, but soon got to realize that this was, as you said, one of the feeder schools for academia in dentistry within the United States. And sort of that whole legacy was inculcated in me, if you like, and over the 2 years that I was there initially, it really cemented my desire to remain in an academic program. One of my advisors in Rochester was a chap by the name of Martin Curzon, who was also from Great Britain. And Martin advised me that if I was going to go back to the UK, I needed to get a master's degree and do some dental research. And I did. I got involved in a master's program, which extended my time in Rochester to 3 years, and basically became hooked on a research career. As I said, the atmosphere at Rochester was a very unique one. It was purely a postgraduate institution, and the sort of the environment there was very much one of excellence and one of perpetuating, if you like, the legacy that Rochester had of developing people for academic programs.
Okay, you graduated there with a certificate in pediatric dentistry from Eastman, and
Right.
a master's degree in dental research from the University of Rochester.
Yeah, where I worked under Erling Johansson.
Oh, you did? That's the 615.
Yeah.
Okay,
Yeah.
so that's interesting.
I'll tell you a little side story on Erling too. He was the head of the dental research department at the university. And as such, when you defended your master's theses, you had to do it in front of a committee that was led by Erling. And everybody that had to undergo that process was very scared of what Erling might produce during the defense. When my defense started, he came into the room, and before he even asked the first question, his assistant came in and whispered in his ear, and he got up and he left the room because he had just published his artificial saliva paper, and the local newspaper had gotten a hold of it and they wanted to interview him. So he left the meeting, which was just great because it was like, okay, we've got rid of Erling now. I don't have to worry about my defense and the difficult questions he might ask. So that was just a little anecdote about that experience with Erling. But he was an interesting character, I have to say that, and he was very hands-on in terms of his running of the department there.
An interesting sideline. Erling was one of 12 students that came to Tufts from Norway
right
after World War II, and I think they came in through Grudewald, who ended up in Rochester, and then in Tufts, and then in Forsyth. And it's a sort of one family, because he went to Rochester, and Dean Huw was the head of the research there. He'd come over from Tufts, and that's how he got there, and that's how he ended up going to what do you call it, as a dean at the dental school.
Sure.
At, Tufts. Yeah.
Yeah.
So you ended up going to for 2 years the University of Texas Health Science Center in San Antonio. Want to tell us about that?
Sure. So after during that sort of 3 years at Eastman, I had decided that, one, I was going to stay for the immediate future in the United States, and two, that I was going to be looking for an academic position. And fortunately, San Antonio was recruiting, and they were prepared to go through all the visa and immigration stuff that I had to do as a foreign national. And so I moved to San Antonio for 2 years. That was a very interesting period of time for me, because it came really with the realization that the research that I had done in Rochester, while was satisfying, I didn't feel that I had the tools necessary to be able to become an independent researcher. So then I started looking at going to look at advanced degrees, and ended up going to University of Connecticut to do my PhD.
There's a couple of interesting people came out of UConn. Valakovic, I don't know if you met him there.
Yes, I knew Rick there very well.
He's on the board of Tufts, and very big in ADEA.
Yeah.
And then John DiBiagio.
Yeah, I didn't know John. I mean, I knew of him, obviously, as the president there. Very little contact at all with him, but obviously that's another part of the Tufts legacy too. Because
John became later the president of Tufts University. This is all related. Okay, following grad. Oh, tell us about your thesis there.
So the program at UConn was one of the first DDS, or dental combined PhD programs. I did the straight PhD program, but the Department of Oral Biology, as it was then, was really a very innovative environment. They had recruited maybe half a dozen top-rated researchers to the department, and so the environment for research and for further study was again very, very inducive and very welcoming as far as I was concerned. So I worked part-time in the pediatric dentistry department, and stayed on after my PhD for about 5 years as a faculty member within pediatric dentistry. And my research career had sort of started to take off. I got an R23, a research development career award. And then I went on and got my R01, my first R01, and really was enjoying my time at Connecticut. It was a very sort of very intellectual, very sort of academically orientated school. Harold Lowe was the dean when I went there. He was replaced by Jim Kennedy, and I was in Connecticut for 12 years. I really enjoyed that time tremendously. And then the opportunity to go back to San Antonio as the chair of pediatric dentistry came along. And sort of the rest is history, as it were. I moved back to San Antonio, and we had a really super pediatric dentistry department. San Antonio was very flush at that time. I had a department of pediatric dentistry with 12 full-time faculty. 5 of them were dedicated researchers. We really had a great time. We were very successful. We had numerous grants come in, and so it was a fun time.
Okay, in 2004,
Yeah,
you end your research and teaching career at the University of Texas and shift your emphasis to education and leadership as Dean of the University of Alabama Dental School, where you stayed 6 years.
Yeah.
Why is University of Alabama important to the Tufts history? And how is Joe Volk's footprint still guiding the University of Alabama?
Sure.
And go ahead, please.
Well, I mean, I had actually looked at a position at Alabama when I finished my PhD. I had the dean then was Lenny Robinson, and I was very close to moving from Connecticut to Alabama. This would have been in 1995. It was an amazingly impressive institution. The Voca McCullum legacy had sort of really driven that school to tremendous heights. The research there was just amazing. It was a very difficult decision for me to go from a department chair where we had a very successful department to assuming the dean's position. But I felt that Alabama afforded me an opportunity to really start making an impact on dental education, and I relished that opportunity, and it really did come to fruition. We had a really great. It was actually 7 years in Alabama, and it was a really excellent 7 years. It was thoroughly enjoyable. We made some significant inroads in curriculum development. We made some significant increases in our research capacity. I think we went from 20th in the NIH roster to 2nd or 3rd. It was a wonderful environment to be in. Yeah, absolutely. And of course, Scotty McCullum was there at the time, and the vocal legacy lived on. In fact, I think it lives on till today. It was an interesting experience. Birmingham is an interesting city. Yeah.
Because McCallum is Tufts, Robinson's Tufts.
Yep.
Volca was the dean at Tufts in the end of the 40s.
There was an endodontist. I don't remember his name. He was from Tufts too. He was head of endo. There was a radiologist at Alabama who was also from Tufts. So it was a great experience for me about to come to Tufts, I guess.
So in 2011, you moved to Tufts as a 16, trained in Rochester. What did you hope to accomplish as an educator, and how did you go about it?
Yeah. So one of the things that had occurred to me more and more at Birmingham, and it was because of the environment at Birmingham, was the concept of interprofessional education. The idea that dentistry is sort of, while it's a standalone profession, is sort of integrated significantly into medicine and the whole health of the body. I felt that Tufts afforded several opportunities to engage in interprofessional education. So that was sort of, I think, perhaps the hallmark of the decision that I made to come to Tufts. And one of the first things that I did when we got there was to develop a strategic plan. And by including the faculty, the students, and the alumni in that planning exercise, I think we developed a really worthwhile and innovative and strategic plan. It was exciting. It was a pathway that we set for ourselves, and we pretty much accomplished most of the issues that we dealt with in the strategic plan. And to give you some of those, interprofessional education was one. Changing the curriculum so that it was more integrated within the program. So, to give you an example, one of the things that, and I had served on site visits to other dental schools for accreditation purposes. One of the things that struck me about that whole experience was that the dental school curriculum is really not very well integrated. You have the first year, the second year, and then you do your national boards. And then you have the third year and the fourth year where you really get your clinical training. And there was no real cross-feeding between those areas. So we developed a program which we called the Basics, which is still going, where we combined first, second, third, and fourth year dental students into teams that were responsible for presenting cases to their fellow students and to the faculty. And the way those worked was that the fourth year dental student would present a clinical case. The third year dental student would talk about the evidence-based literature that supported the treatment plan that the fourth year dental student had proposed. The second year dental student looked at any of the pathology or the sort of the medical histories that impacted the care of these patients. And then the first year dental students would report on the normal tissues that were involved. So you had the first year dental students understanding why they were learning what they were learning to become fourth year dental students. And then you had the fourth year dental students remembering why they'd learned all that stuff in the first year to begin with. So we really have integrated or had integrated that whole experience. So some of the other areas that we really looked at were wellness, student wellness. We developed a student wellness program, which is still in effect today. We have a female faculty, Christina Paston, who is a wellness expert. She developed an entire program for our dental students and, in fact, for faculty and staff that sort of looked at stress levels, stress management, that whole sort of area. One of the areas that I had learned from my experiences with ADIA was the impact or the need for increasing the representation of minority students within dental school. And so working with Rob Kasberg, who was the admissions dean, we really have put together a program or programs where qualified minority students were encouraged to apply to Tufts. And we've made significant progress in terms of the numbers of minority students that we graduate now. Similarly, women, you know, the proportion of women in dental school, the sort of matriculated students, went from 30% to 60%. And so with that influx of women into the profession, I felt it was really necessary for us to have role models within our faculty that supported those students. And so many of the senior positions that we recruited to were filled by women faculty, and I think that really benefited the student body. Another area, I mean, as I mentioned right at the very beginning, one of the biggest impacts on my career was the opportunity for me to come to the United States for 6 weeks as a senior dental student. That experience made a huge impact on me, and I felt that having our students have that same opportunity was also a very important one. And so the development of our global outreach programs with the help of Nosha Mehta, we really have increased a number of our students that get an opportunity to study abroad, and at the same time bring students from other schools to Tufts for them to see how we do things.
Okay. Profile the educators at Tufts and at the ADEA that you worked with.
Yeah.
What about our present dean, Nadim Karambaks?
Sure. Nadim, I was really very fortunate that we were able to recruit Nadim from Harvard to a position as Associate Dean for Academic Affairs. He and I think, were totally on the same page in terms of where we wanted, where we felt dental education should move to. I respect his ethics. I respect his hard work in the industry, and he was the easy choice for me in terms of academic affairs. And I can't imagine a better dean to succeed me and move the needle forward. Who else do you say? Valakovic, Rick Valakovic and I have become good friends. He, as you mentioned, was at Rochester. It was because of his influence that I was able to chair the research committee in the American Academy of Pediatric Dentistry. That set me on that particular pathway. Kathy O'Loughlin, as you know, I mean, has had a wonderful career as ADA executive director, and what a tremendous lady she is, and what she's accomplished. A terrific lady. Lonnie, obviously, I got to know Lonnie as well, and I think Lonnie needs to be credited really with turning Tufts around. I mean, in the mid-90s when he took over, things were pretty rough, and he steered the ship through those storms, and really left a position available to me that was very easy to assume. Larry Bacow, I didn't know Larry very well. In fact, Larry Bacow and Barushka, the then provost, were both leaving as I came to Tufts. So Tony Monaco, the current president, and I actually started on the same day. So I got to know Tony, obviously, but I didn't know Larry very well. But obviously he has had a very successful career both at Tufts and now at Harvard.
Because Lonnie Norris and Bacow were, especially probably Lonnie, were the two that put together that 5-floor extension of the building.
They certainly did.
And that was no simple thing.
No, absolutely right. absolutely. That must have been a really interesting time. I mean, there was no stone left unturned on that one.
And they made it, yeah, they made it work.
They
Now,
did.
and recall the thought and preparation that went into the Tufts sesquicentennial of 2018.
Yeah.
The gala event at the Science Museum and the conference on the future of dentistry and healthcare.
Yeah, that was, I mean, how fortunate was I that I was dean at that sesquicentennial, and it was a remarkable build up to the conclusion at the Science Museum. A spectacular time, and I think too the cementing the sort of direction that Tufts was going in, and not just going in. I think Tufts really was at the forefront of dental education, innovation, and how we can train a better product, a more contemporary product at the end of the 4-year training. Yeah, that was special.
Okay, are you satisfied with a life spent as a leader in academic dentistry? And have you reached your goal of providing the Tufts graduate training, dental education that combines cutting-edge science, state-of-art technology, and integrated patient care?
I don't think I can honestly say we've reached the goal. We're on the way. I think with the student body that we have at Tufts, which is a very unique student body in many ways, with the faculty that we have, and also with the alumni support, I think that we're well on the way to training and graduating individuals that are very well prepared to practice dental medicine in the future. There's no doubt about that. I'm very well satisfied with my career in academia. It's if you'd asked me when I was a dental student, is this how I'm going to end up? I wouldn't have had a clue as to whether that was true or not. Opportunities came along, and it's like when those opportunities come along, you have to grab yourself by the seat of your pants and just go for it, and going for it worked out. So I'm delighted with my career. I'm very blessed to have had those opportunities. And going back to what you have said, there's no doubt that there are certain institutions within the United States, dental education institutions, that that are responsible, for whatever reasons, for generating successive generations of academics. And I was very fortunate to start at Eastman. That made a huge impression on me in my career. Then combined with San Antonio briefly, and then Connecticut, again, another wonderful institution to be associated with, taught me a lot. I've been blessed with tremendous mentors throughout my career. Then Alabama, and then Tufts. So somewhat incestuous, if you like, in a way, but I'm glad I had the opportunity to take advantage of that.
Who were a few of the mentors that changed your life?
Well, starting in dental school, there was a head of our pathology department, Tom Lehner, who did a lot of work with oral biology, microbiology, that looked at a lot of the immunology of caries. He was a tremendous impact on me in my dental school. Bill McHugh at Eastman, Martin Curzon at Eastman, Connecticut, Harold Lowe. I remember working in the lab one night. I was dissecting mouse embryos, and it was close to midnight. And I'm at the lab bench doing this, and all of a sudden I'm aware of someone standing behind me, and it was Harold Lowe. And he wanted to know what I was doing, and I was explained to him. And you know, when you're in an environment where your dean is in your lab at 12 o'clock at night and asking you what you're doing, it's comforting. It reassures you that you're doing something right. Harold was a big influence. Jim Kennedy was a big influence. My PhD advisor, Ed Kohler, was a tremendous individual. I learned an amazing amount of stuff from him. Back in Alabama, I was fortunate to have Eli Capilouto as the provost. And Eli, it was interesting having a dentist as a provost, because on the one hand, he knew exactly what was going on within dental education, but on the other hand, he knew exactly what was going on in dental education. So it was an interesting relationship, but I really benefited tremendously from Eli. And you know, even coming to Tufts, Tony Monaco was someone I really admire. Is someone I really admire. And the women. I'm a father of two daughters, and so women have always been a special part of my life. And as I said earlier, with the huge increase in women coming in to dental school as students, and being able to provide them with role models in senior leadership positions within the school. I think that was something that I really enjoyed doing too. And of course, you know, the other thing too is in Alabama, it was we had a huge research enterprise. In Tufts, while we have got, you know, several really first-class researchers, we really focused most on student research, because I think that providing students with an opportunity to look at investigative methods, to work with mentors, and to have that opportunity of going to national and in some cases international meetings to present their research. You can't ask for more than that.
Okay, as we come to the end of this, I want you to just spend a moment on the COVID virus.
Yeah.
How did the dental school manage it? Karen Bucks was the dean, couldn't have been easy. And how did organized dentistry fare under Kathy O'Loughlin, who's about to retire, within the COVID virus and our future?
Yeah, I think that I really do admire the way that Nadim has navigated the crisis. I mean, I have a good friend who was the dean at Connecticut, and we both retired just before the pandemic. And every time we speak to each other, we sort of count our lucky stars as the fact that we got out before the pandemic really hit. But I think Tufts and as I said in particular, Nadim has done a really stellar job in navigating that. Obviously, it's been a huge impact on the school, but I really think that we are positioned to really sort of take the next leap forward now. And I think Kathy has done the same thing at the ADA. I think that she's managed that crisis very well. The one thing that does strike me, and if I were, I guess, if I were involved in dental education at the moment, I think one of the things that COVID does point out to us, or the pandemic does point out to us, is the value of interprofessional interaction in terms of patient care. We're all in this together. And as the Surgeon General's report said, it's the mouth is part of the body. And, I think that that experience has perhaps helped in terms of integrating dentistry and medicine much more so than before.